We're all pretty familiar with household waste, right? The bins overflowing in the kitchen. But here's something else to think about. Healthcare activities, they generate a different kind of waste. Used needles, maybe even radioactive materials, stuff that carries, much higher potential for infection and injury.
It's a starkly different risk profile, absolutely.
Yeah.
And that difference is exactly why managing healthcare waste safely isn't just about being tidy. It's really critical for protecting public health and the environment, too, from some quite serious hazards.
For sure. And that's what we're diving into today. We're using a really comprehensive guide put together by international experts in the World Health Organization to sort of navigate this.
It's a hefty piece of work, very thorough.
It is. So for you, our listener, you want to get up to speed quickly but properly, right? We'll pull out the core stuff, those aha moments, hopefully without drowning you in jargon.
And this guide, it really covers the whole spectrum, from how you categorize the waste right through to handling it in emergencies. A valuable resource.
Okay, so our mission for this deep dive. Let's understand the different kinds of healthcare waste, the risks they pose, and the essential strategies for managing them safely. And, sustainably too. Ready to jump in?
Let's do it.
All right, so what are the main types of waste we're actually talking about here?
Okay, so the guide breaks it down into several main categories. First up, there's highly infectious waste.
Highly infectious, huh?
Yeah. And that, along with other infectious waste, plus pathological and anatomical waste, think tissues, body parts needs to go into yellow containers, specifically marked yellow containers with the biohazard symbol.
That universal pointy symbol.
That's the one. And this color coding, it's actually a key insight. It shows this global push for immediate visual warnings. Helps cut down errors, improve safety everywhere.
Makes total sense. Clear signals for the really dangerous stuff. What else is on the list?
Then you have sharps waste, needles, scalpels, anything that can cut or puncture. These also go in yellow containers. But, and this is critical, the containers have to be puncture-proof. Really tough. And again, marked with that biohazard symbol.
Okay, puncture-proof is key there.
Absolutely. And remember, sharps, whether you can see blood on them or not, are considered highly hazardous just because of that risk of injury, the number of infections just from sharps injuries. Well, it really highlights why safe handling is so vital.
Yeah, I can imagine needle stick injuries are a huge worry for healthcare workers. So after sharps.
We also have chemical and pharmaceutical waste. Then there's radioactive waste that could be unused radiotherapy liquids, contaminated lab glassware, even excreta from patients who've had certain treatments.
Wow, okay.
And sealed radioactive sources, too.
Yeah.
And then finally, there's the non-hazardous or general healthcare waste, sort of like regular office or kitchen waste from a hospital.
And the radioactive stuff, does it have special labels?
Oh, yes. Very distinct. The container has to clearly say radioactive waste and show that international radiation symbol, the trefoil.
Got it. So, quite a range of materials, each with its own challenge. Let's dig into chemical waste a bit. What makes it hazardous?
Well, the guide points out chemical waste is hazardous if it's, say, flammable or reactive.
Reactive,
meaning it could explode or react badly with water or even just from being bumped or shocked. Or if it's an oxidizing agent.
Okay.
A really common example in hospitals, formaldehyde, used all over for disinfection, preserving samples.
Right.
But then you also have non-hazardous chemical waste. Things like sugars, amino acids, some salts you might find in IV fluids. They're fine.
So it's not always obvious just by looking? What about infectious waste then? How do they decide if something is infectious?
It really comes down to the probability of a transmitting disease. The guide talks about the chain of infection.
The chain of infection.
Yeah, you need several things. A pathogen, first off. Then enough of the dose, and it needs to be virulent enough. Then a way for it to spread, like a spill or a broken container. Then a way into someone, a portal of entry, like a cut or breathing it in. And finally, you need a susceptible host.
Like a healthcare worker.
Right.
Or someone handling the waste.
Exactly. Cleaners, waste handlers, even people scavenging at dump sites, unfortunately.
Yeah.
And what's interesting is, context matters hugely. A country with really strong safety systems might not classify, say, dried blood on a bandage as infectious, but in a place without proper containers, without good protective gear for workers, that same bandage could be a real risk. It really shows how infrastructure impacts the danger level.
That's a really important point about context. So what happens when this stuff isn't managed properly? What are the big public health impacts?
They can be really severe. The guide mentions estimates from back around 2000 Something like 66,000 hepatitis B infections, 16,000 hepatitis C, and maybe 200 to 5,000 HIV infections every year among healthcare workers, just from sharps injuries.
Wow, that's staggering.
It is. And a big chunk of those were linked directly to their job occupational exposure. It's estimated over 2 million healthcare workers worldwide get percutaneous injuries, needle sticks or cuts from infected sharps annually.
2 million. And it's not just the professionals at risk, you said?
No, sadly not. People who scavenge on waste disposal sites face significant risks from discarded sharps too. The data isn't perfect, but the danger is clear. And the guide also touches on potential long-term issues, like from genotoxic waste like some anti-cancer drugs. There are studies suggesting links between exposure and things like spontaneous abortions or birth defects, though it's a complex area needing more research.
So, beyond the immediate infection or injury risk, there are these other potential health worries. What about the environment?
Environmentally, a big concern is vectors.
Vectors, you mean like?
Rodents, insects, flies. If waste isn't managed properly, these creatures can get into it, pick up pathogens, and then spread them outside the hospital or clinic, basically creating a pathway for disease.
Right. Okay, so we've got a good picture of the waste types and the dangers. Let's switch gears to managing it. What are the core strategies?
Well, the guide really pushes a hierarchy.
Yeah.
And right at the top, before disposal or even treatment, is assessment. You need good data.
Data collection. How does that work?
Ideally, daily. From every single department or area generating waste, you need to know what types of waste are being produced, where, and how much. So, segregating it properly at the source, weighing it.
Weighing the waste?
Yes, weighing each type. And then comparing that data to things like the number of patients or beds occupied, it gives you a baseline. And doing this over a longer period, say a month or more, gives a much better, more accurate picture than just a quick snapshot. You can't manage what you don't measure, essentially.
Okay, know your enemy, basically. What's next after assessment?
Waste minimization. Always the best approach if you can do it. It's better environmentally, economically, socially, all around.
How do you minimize healthcare waste?
Several ways. One big one is environmentally preferable purchasing, or EPP. Yeah, basically buying smarter. A classic example is switching to mercury-free thermometers. Gets rid of the mercury hazard and the cost and hassle of disposing of it safely.
Makes sense.
Another huge area is managing your stock, especially chemicals and pharmaceuticals.
Oh.
Ordering smaller amounts more often, using the oldest stock first, that first in, first out principle. Checking expiry dates religiously. Setting up systems to return unopened, unexpired stock if possible. Just good inventory control can cut waste dramatically.
So, being really smart about what comes in the door and how it's used. What about reusing things? Is that ever an option?
The guide talks about it, but carefully. Things like single-use plastic syringes or catheters. Absolutely never reuse those. That's a definite no.
Right.
But some items can be recycled after proper sterilization. And some devices are actually designed for limited reuse by the same patient, maybe a urinary catheter or an oxygen mask.
Yeah.
Those need thorough cleaning with mild detergent between uses.
Okay, specific cases then.
And an interesting minimization idea mentioned is composting hospital food waste. The guide cites a UK hospital using an in-vessel composter. Keeps food scraps out of the general waste stream.
That's quite innovative for a hospital setting. Okay, so you minimize what you can. What about the waste that's left? How do you handle that properly from the start?
Segregation and collection. Absolutely vital. And this is where the WHO color coding comes in again. Yellow for infectious waste and sharps, remember?
Yep. Yellow bags or bins.
Exactly. And they need the right markings. Sharps must go into those puncture-proof containers we talked about. Cardboard safety boxes can also work for sharps if designed properly.
And where should this happen?
Ideally, right at the point of care. Bedside disposal is best if feasible. Using mogul trolleys kitted out with the right colored bins helps too. And collection needs to be on a fixed schedule, with general waste always kept separate from the hazardous stuff.
Makes sense to keep them apart.
And a crucial detail. Bags or containers should only be filled about 3/4 full. No stuffing them. Then seal them securely tied off or tagged. Never use staples that can puncture the bag or injure someone.
Good practical tips.
Yep.
So once it's collected inside the hospital, how do you move it around safely?
On-site transport needs care. Try to do it during quieter times, using planned routes that avoid patient areas as much as possible.
Like service corridors.
Exactly.
Yeah.
If possible, dedicated floors, stairs, or elevators for waste transport are ideal. And the staff doing the moving, they absolutely need proper PPE. Gloves, closed shoes, overalls, masks sometimes, full protection.
Right. And what about storing this waste temporarily before it's treated or taken away?
Storage areas have specific requirements. They need to be designated, secure from weather and unauthorized people, easy to clean and disinfect, and clearly signed with hazard symbols, biohazard, radioactive, chemical hazard, whatever applies.
And signs inside, too.
Yeah, no eating or drinking, no smoking, basic safety. For infectious waste specifically, the area needs that biohazard sign. Impermeable floors and walls, ideally connected to a special sewage drain if possible. If you have to store it for more than, say, a week, refrigeration is recommended between 3 and 8 degrees Celsius.
Keeps pathogen growth down.
Exactly. There are specific time limits for storage depending on the temperature if you don't have refrigeration. It's all about containing the risk until it can be dealt with.
Okay, secure containment. Now, what about when it leaves the facility? Off-site transport.
That needs purpose-built vehicles. They should be lockable, well-maintained. Things like articulated lorries or demountable trailers work well. Definitely not open-top trucks or containers. Too much risk of spills or exposure.
And markings on the vehicles.
Yes. Needs the carrier's name and address, the proper hazard signs, and an emergency contact number. Very important.
And paperwork.
Absolutely critical. A detailed consignment note has to travel with the waste. It needs to list everything. What type of waste it is, where it came from, pickup date, destination, driver's name, container details, volume, and it needs a signature confirming receipt at the other end. It's about tracking and accountability.
That chain of custody seems vital. Okay, let's shift focus a bit. We've talked solids, but what about wastewater from healthcare facilities? That seems like another big challenge.
It really is. The guide stresses that all healthcare wastewater should basically be treated as potentially infectious, like domestic sewage, but possibly worse because it might contain chemicals, drugs, biological agents, even radioisotopes from specific departments.
So extra risks.
Definitely. And if it's not managed properly, you can get waterborne diseases, vector-borne diseases spreading, plus environmental issues like eutrophication.
Eutrophication?
That's when excess nutrients like from untreated sewage get into rivers or lakes. Causes massive algae blooms, uses up all the oxygen, kills fish. Not good. Nitrate contamination of groundwater is another risk.
So what's the key principle for managing it?
First rule, hazardous liquids don't go down the drain. Photochemicals from X-rays, aldehydes like formaldehyde, strong colorants, unused liquid pharmaceuticals, they need separate collection and proper disposal, not into the sewer.
There's probably a symbol for that, right?
Yes, a do not discharge a symbol. Lab wastewater often needs pre-treatment too. Maybe neutralizing acids or bases, filtering out solids, even autoclaving before it joins the main wastewater stream.
And basic treatment on site.
The guide outlines the standard stages. Primary treatment is usually screening to get big stuff out, then letting grit settle, then sedimentation for smaller solids. Secondary and tertiary stages involve biological processes and further purification.
Like a mini sewage plant.
Pretty much. It's just as important as maintaining the pipes. Regular checks for leaks, clearing blockages, often caused by people flushing solid waste they shouldn't. Solid hazardous waste should never, ever be mixed with wastewater.
Okay. What about disinfectants like chlorine?
Small amounts of diluted chlorine, like less than 0.5%, might be okay in a soak-away pit in some limited situations, but definitely not in septic tanks. It kills the bacteria needed for the tank to work.
Got it. So, a careful, multi-stage approach for liquids. Now, back to the solids. What are the main ways to actually treat this waste to make it safe?
The main goal of treatment is always to reduce or kill the hazards. A really common method is steam autoclaving.
Like a giant pressure cooker?
Essentially, yes. You use high-pressure saturated steam at a specific temperature for a set amount of time to sterilize the waste. There are different ways autoclaves get the air out first, gravity displacement, pre-vacuum.
How do you know it worked?
They use special indicators, often tapes or strips that change color when the right temperature and steam penetration have been achieved. Some advanced autoclaves even shred or grind the waste afterwards to make it unrecognizable and reduce volume.
Okay. What else besides autoclaving?
Microwave treatment is another one. You can get smaller batch systems or bigger semi-continuous ones. They often shred the waste first, inject steam, then zap it with microwaves to heat and disinfect.
High tech.
Some large units can process hundreds of kilograms an hour. They usually need good filters, like HEPA filters, to catch any airborne particles. Then there's dry heat treatment, uses conduction, convection, or radiation, but typically needs higher temps and longer times than steam, so it's less common for large volumes.
And chemical disinfection.
Yeah, using chemicals like sodium hypochlorite bleach, basically. It's effective against lots of bugs, But organic material like blood or tissue can reduce how well it works. Plus, it can be irritating and might form toxic byproducts if it reacts with certain things. Chlorine dioxide is sometimes used as an alternative.
What about incineration, burning the waste?
Incineration is definitely a major treatment method, especially for certain waste types. The basic idea is high-temperature burning in a furnace, often with an afterburner chamber to destroy remaining pollutants, followed by cleaning the flue gases before they go up the chimney, and then dealing with the leftover ash.
Sounds straightforward, but are there downsides?
Oh, yes. The big concern is air pollution, particularly dioxins and furans, which are really nasty, persistent pollutants. If you don't use the best available technology and strict controls, incineration can release these. The Stockholm Convention has guidelines on emission limits.
How do they clean the gases?
Various methods, wet scrubbers, dry systems, semi-dry, all designed to capture pollutants. There are also alternative thermal processes like pyrolysis and gasification, which heat waste with very little oxygen, breaking it down differently than incineration.
And co-incineration?
That's burning healthcare waste in, say, industrial cement kilns. It's done in some places, but raises concerns about handling the waste safely beforehand and ensuring the kiln's pollution controls are adequate for medical waste. The Stockholm Convention actually advises against it for infectious waste.
Okay. Are there systems that combine shredding and disinfection?
Yes. Some systems shred things like needles and then autoclave the plastic bits, which can sometimes even be recycled into basic products afterwards. Though maintaining the shredders can be an issue.
Interesting. What about specific waste types? Pharmaceuticals, for instance.
Big emphasis on minimization first, like we discussed, smart ordering, stock rotation, checking expiry dates, that just-in-time approach.
Right.
Then before treatment, proper labeling and sorting are key, maybe by the type of drug or its active ingredient. Special care is needed for controlled substances, antibiotics, cytotoxic drugs used in cancer treatment, and disinfectants.
And disposal.
High-temperature incineration is often the preferred method, ensures complete destruction. Chemical degradation, according to manufacturer instructions, is another option for some drugs. But definitely not just municipal incineration or open burning, especially for cytotoxic waste. That's a major no-no. The guide even gives specific chemical breakdown procedures for certain cytotoxic drugs.
Very specialized. And radioactive waste.
Again, clear identification and labeling are paramount. Then segregation based on half-life is crucial. Short-lived stuff, under 60 days, can often be stored securely until it decays to safe levels.
So you just wait it out?
For short half-life isotopes, yes. But, and this is important, if that waste was also infectious, it still needs disinfection after it's no longer radioactive.
Oh, okay. Double hazard.
Exactly. Syringes with radioactive residues, empty them safely, store the sharps container for decay, then dispose of it like normal sharps waste once it's safe. Things like autoclaving or microwaving aren't suitable for solid radioactive waste itself. And generally, you want to destroy solid radioactive waste before final disposal to prevent anyone trying to reuse it.
Makes sense. So after all this treatment, or if treatment isn't possible, where does it end up? Land disposal seems inevitable sometimes.
It often is, especially when treatment options are limited. But the guide makes a huge distinction between proper, controlled landfill disposal and just open burning or dumping anywhere. A controlled landfill, even a basic one, offers much more protection.
What makes a landfill controlled?
Key things include careful site selection away from water sources, lining the basin sides with impermeable material like clay or plastic to stop leachate escaping.
Leachate being the contaminated liquid.
Exactly. You need systems to collect and treat that leachate. Waste should be deposited in an organized way, compacted and covered with soil daily to reduce smells, pests, and wind scatter. Good surface water drainage around the site is important too, and a final cap when it's full.
What about places with fewer resources?
The guide suggests minimum approaches. Maybe modifying existing autoclaves to work better, using hypochlorite disinfection for some things. Anatomical waste could be respectfully buried in cemeteries. Treated waste, except sharps, might potentially go with regular municipal waste if the landfill is decent. Safe burial pits on site for small facilities without other options. Encapsulation is another technique.
Encapsulation.
Yeah, putting sharps or maybe old pharmaceuticals into a hard container like a drum and filling it with something immobilizing like cement or plastic foam before burial. Inertization is similar. Well-designed sharps pits are also an option.
So ways to make disposal safer even with basic infrastructure. Can these basic methods be improved?
Definitely. Better segregation and minimization always help.
Yeah.
Adding shredders or compactors to existing autoclaves or microwave units boosts efficiency, especially for sharps. Regular testing to make sure treatment equipment is actually working. Better ventilation in waste areas. Proper maintenance is huge. For incinerators, adding or upkeeping air pollution controls to meet standards like the Stockholm Conventions and managing the toxic ash properly are critical improvements. Continuous emission monitoring, regular upkeep, and thinking about cleaner technologies when old incinerators need replacing.
It's a continuous improvement process. Okay, let's shift to the people involved. Hygiene and safety for staff seem paramount.
Absolutely. The guide comes back to that chain of infection. Breaking the links is key. Hand hygiene is just fundamental. Wash hands properly, use alcohol rubs effectively.
The basics, but crucial.
Crucial. Also, cleaning equipment before disinfecting it makes the disinfectant work better, and choosing the right disinfectant for the job. Remember, this waste can be crawling with infectious agents. Standard precautions treating everything as potentially infectious are essential.
What else helps improve infection control?
Avoiding wasteful practices that generate unnecessary waste. Using simple, low-cost, good practices consistently. Making sure PPE is used correctly and is available. And it's a team effort. The guide stresses needing a multidisciplinary infection control committee in the facility.
Makes sense. What about specific health and safety risks for the waste handlers themselves?
The core principles are prevent exposure, raise awareness, ensure everyone knows the best practices, and foster responsibility. The risks are varied infections, chemical burns, radiation exposure, sharps injuries. We mentioned those shocking sharps injury stats earlier.
Yeah.
Ergonomic risks, too, back injuries from lifting heavy bags or containers.
So what protective measures are needed?
General stuff like the right PPE for the task, good training, keeping awareness high. For specific high-risk waste like cytotoxic drugs, you need specialized gear. Chemical barrier gloves, proper gowns, goggles, face masks.
And spills. Accidents happen.
Need clear practice procedures. Know how to contain it, figure out what was spilled, might need to evacuate the area temporarily, handle contaminated materials safely with the right gear, and have spill kits readily available. Absorbents, disinfectants, containers, warning signs. The guide gives step-by-step examples.
Reporting seems important too.
Vital. Staff need training on reporting everything: accidents, near misses, spills, damaged bins, finding waste in the wrong bag, and especially sharps injuries. Report it to the waste management officer or supervisor immediately.
You mentioned ergonomic risks. Back injuries. How can those be reduced?
Simple things often help. Reducing the weight in bags, using trolleys with good wheels, automated systems if possible, like chutes or conveyors, lifting aids like hoists, thinking about how people lift and move things.
Training underpins all of this, doesn't it?
Absolutely fundamental. The guide sees training as integral to the whole system. It links to quality improvement, policy adherence, staff evaluations, everything. It even suggests putting healthcare waste management into the basic training for doctors, nurses, dentists. Build it in from the start.
How should training be planned?
Identify who needs training managers. Clinicians, cleaners, porters, waste handlers all need different things. Define clear learning objectives. Choose the best way to deliver it on the job, workshops, online modules. Develop a detailed curriculum.
Tailored training.
Exactly. Managers need the big picture, regulations. Nurses need practical skills at the bedside. Waste handlers need hands-on training in their work environment, focusing on safe handling, PPE, spill response. Treatment plant operators need specific technical training on the equipment, safety, maintenance. Landfill operators, too.
What about reaching everyone else? Patients, visitors?
Information campaigns are key there. Clear signs, pictograms, simple pictures work well. Using that consistent color coding placed right where the bins are. Make it easy for everyone to do the right thing.
Okay, comprehensive training and awareness. One last major area the guide covers is emergencies. Why is emergency preparedness so important for waste management?
Because emergencies, floods, earthquakes, disease outbreaks can completely overwhelm normal systems. Waste volumes might skyrocket, infrastructure gets damaged, transport is disrupted. You need plans in place before it happens.
Makes sense. Experienced systems cope better.
Generally, yes. Facilities with good routine waste management are usually better prepared to adapt during a crisis. The guide talks about emergency waste management in 3 phases: rapid assessment, immediate response, and longer-term recovery.
Let's look at that first phase, rapid assessment. What's the goal there?
Get essential information quickly to the responders. Understand the immediate, critical waste management needs caused by the emergency. It won't be perfect data at first. It'll need refining, but it's a starting point.
What kind of information?
Things like, what were the existing waste systems like before the emergency? What kinds and amounts of waste are being generated now? How are emergency medical teams handling waste? What equipment is available? How is waste being disposed of right now? Are there suitable sites for safe burial if needed? Who's doing the work? What resources are available? Are there reports of injuries? Assessment teams need to visit sites, gather info using standard methods if possible.
So a quick snapshot of the situation on the ground. Then the immediate response, what are the minimum options if normal treatment or disposal is impossible?
Often it comes down to safe burial on site, especially for infectious waste, sharps, and pharmaceuticals. Properly constructed pits are key right size, maybe lined if possible, covered daily, fenced off.
Like a mini landfill.
In essence, yes. For disease outbreaks, adding lime to the pit helps disinfect. Sharps absolutely must go into proper sharps boxes immediately to prevent injuries. Old vaccine vials, anatomical waste, safe burial again. If there's access to a municipal dump, maybe creating dedicated burial cells there, dug to specific dimensions and covered daily.
You mentioned encapsulation before, too.
Yes, that's a good option for sharps and pharma waste in emergencies, sealing them in drums with cement or similar. For unwanted pharmaceuticals, options include incineration if available, chemical inactivation, return to supplier if possible, controlled landfill burial cell, encapsulation, or secure on-site burial as a last resort. Never flush them. The guide has detailed tables on this. Sometimes basic double-chamber incinerators can be deployed.
So practical, safe as possible solutions for tough innovations. Finally, the guide brings up climate change. How does that connect to healthcare waste?
In several ways. More extreme weather events, floods, storms, heat waves mean more injuries, potentially more disease outbreaks, which means more healthcare waste.
Right.
Plus, those same events can damage waste. Infrastructure, storage areas get flooded, treatment plants lose power, roads become impassable for transport.
So climate change makes the problem worse and harder to manage.
Exactly. So contingency planning is vital. What do we do if collection services are disrupted by floods? How do we manage storage if heat waves shorten safe storage times or cause power cuts affecting refrigeration? We need to think about low-energy treatment options, maybe renewable energy for waste facilities, really push waste minimization harder, and have robust plans at every level to cope with these climate-related disruptions. Resilience is key.
This has been incredibly thorough, a really deep dive into something complex but so important. As we wrap up, what's the single most critical takeaway for our listeners?
I think it's just the fundamental importance of managing healthcare waste safely and sustainably. It's not optional. It's not just nice to have. It's absolutely essential for protecting public health, protecting healthcare workers, and protecting our shared environment. Proper handling, treatment, disposal, they are core responsibilities.
Absolutely. And a final thought to leave everyone mulling over.
Well, thinking about how connected our health is to the environment, maybe ask, what role can we, as individuals or communities, play in supporting responsible healthcare waste practices, even outside of hospitals? And maybe more broadly, with threats like pandemics and climate change growing, how do we make sure our waste management systems are truly resilient and adaptable for whatever the future throws at us? It needs ongoing effort, innovation, and everyone working together.
Powerful questions indeed. Really highlights the scale and importance of this. If you want to explore this further, clearly there's a lot more depth available, as our discussion showed. Thank you so much for joining us for this deep dive.